in and I do hand hygiene, introduce myself to the mother if the mother's in the room. I would check baby's armband to make sure I have the right baby. I would then start to assess my baby. I first want to listen to the heart, the respirations, and you do that for 1 full minute each time. And then you'd also want to check for bowel sounds before you get them all worked up. Then next you'd take the vitals. You would take the temperature in the armpit. You don't need to do a blood pressure. They did one when the baby was delivered. We already checked for the respiration and the heart rate. Next, you would check the head. You would check to make sure if there is molding. You would check to fill the suture lines, to see if there's caput succedaneum, which would be swelling. That can cross between suture lines. Or you can check to see if there is a cephalohematoma, which would not cross, it either be on one side or the other. Next, you would check the eyes of the baby. You'd want to make sure that the eyes are a third, the nose is a third, and then another third on the eyes. You'd want to make sure that the ears are midline. And then you'd also fold the ear down to check the recoil. If it's a premature baby, recoil isn't as fast moving up. Next, you'd want to check the nares. You want to check the patency, so you would block one and fill for air out the other, block the other, fill for air out the other. Then you'd want to put gloves on, and you'd want to touch around the sides of the mouth for the rooting. And then you'd also want to stick a finger into the mouth and check the palates to make sure that they are good. And then also you can check the sucking reflex too. Next, you'd check the neck. You want to make sure that there's no abnormalities, everything's feeling good. Make sure that the baby has good range of motion. You want to check the clavicle. The clavicle can have some, it can break within being delivered sometimes, especially in the bigger babies. So you want to feel around and make sure that it's okay. The baby cannot be moving the arm as much. It'd just be very painful for the baby. Next, you'd want to check the abdomen. We've already listened for the bowel sounds. You want to just make sure that there's no abnormalities or any distension of the abdomen. After that, we'd want to check the umbilical cord. You want to make sure that the umbilical cord is dry, not tucked in the diaper or getting wet. The clamp stays on the baby throughout the stay, and then we take it off when they are being discharged to home. Then you would check the diaper, make sure that they're dry. I have a female baby. You'd want to check if they are full term, they're going to have the labia major is going to cover the labia minor. But if they are preterm, the clitoris and the labia minor might still be showing. You'd also want to note if there's any discharge. Babies still have a lot of the mom's hormones in them, so you could see like a white discharge or some spotting. And then you'd want to cover her back up. If it was a male, you would want to check for the rugae. If it's a full-term baby, they're going to have deep rugae. If they are a preemie, they might just not have as much. You'd want to check the urinary meatus. You want to make sure that it's at the tip of the head. And then you'd also want to check the testes. You want to make sure that they have descended. So you check one with your thumb pressed down on your finger, and then you check the other side. Next, you would want to flip baby over and check for any abnormalities in the spine. You want to make sure that there is no hole or a little spot there, because it could signal spina bifida. You'd also want to check the skin color of your baby. Some babies can get cyanosis, acrocyanosis, where they turn a little blue. They could just be a little cold. They could, you want to check for the birthmarks. You want to make sure that you take off the clothing to check all the arms and all the legs. Birthmarks can be anywhere. You'd also want to check if it was a different ethnicity. They may have the Mongolian spots. You can also check for the angel kisses, the stork bites. And then you'd want to cover baby up so they don't get cold. You'd also want to check for jaundice. Jaundice can be in 5 places. It can be in the forehead. It can be in the chest, the abdomen, the thigh, and then right back to the eye. You want to check for any yellowing of the skin, any yellowing of the scleratus. You'd also want to check on your patient for any respiratory distress. That's the respiratory rate, heart rate. Is the baby grimacing? Are they feeling like they're not able to breathe? You'd also want to check the baby's feet and palms. You'd want to make sure that they have 10 fingers and 10 toes. And then on the bottom of the feet, if it's about 2/3 of the way, you'll see creases, more creases, full term. Typically in a preemie, the sole of their foot's more smooth. And then in the palms, you want to see more creases. If there's just a single crease, that could be a symbol for Down syndrome. While you're looking at the feet, you can do the Babinski, where you just do a J at the bottom of the foot and see if their toes curl. You'd also want to try the Moro reflex, which would be a clap or a slap of the table, and you'd want to see if the baby cries or flinches their hands up in a C. You can also check to make sure that their dimples are even, that when you put their feet down, that their knees are even. You can check the recoil of the arms, and you can either bend it up or bend it down, and the baby should recoil it back. And then you'd want to ask the mom, when's the last time the baby voided? When's the last time you fed the baby? You want to make sure that the baby is having proper bowel movements and voids. And that is it. And cover your baby back up.